WBTV's Good Question is a member of the Queen City Podcast Network, powered by Ortho Carolina. Now offering video visits so you can take control of your orthopedic care from the comfort of your home. Schedule online at orthocarolina.com. Ortho Carolina, you improved.
For more than a year now, face masks have become a part of daily life, but now many of us can take them off. It's become a divisive decision, though. Is there still a benefit to wearing the masks?
You're not coughing on people, you're not breathing on people, you're not going to transmit illness.
Can they still help post-pandemic? This is WBTV's Good Question. Okay, welcome to WBTV's Good Question. Alex Giles here, joined by my colleagues Jess Dyer, Jamie Bull from WBTV. Today we're talking about masks and the pros and cons of potentially continuing to wear them, even as restrictions ease up across the Carolinas and across the country. Here in North Carolina, Governor Roy Cooper made the big announcement in mid-May, saying that restrictions were going to be easing, a lot of the mandates going away, including most of the mandatory mask requirements. And full transparency at WBTV, once the governor made that announcement, we didn't have to wear the masks in the building any longer. But I think a lot of people are still carrying the mask around just because depending on the setting you go in, some grocery stores may still be requiring the masks, even if you are fully vaccinated. I think a lot of people are trying to toe the line here and figure out what they should keep doing.
That's the thing, right? Yeah, you walk into a place and that's what I do. First thing is I kind of look around, what's everybody else doing here?
Yep.
And to me, it's like, to wear it to run into the grocery store for 5 minutes isn't a big deal one way or the other. It wasn't during the pandemic. I don't think it's now that I'm vaccinated and feel like I'm fairly safe to not wear it. And there's times where I go into places and I take it off. And, like the gyms, for example, are reopened like that. And it was one of the reasons I wasn't going to the gym because I was going to have a hard time, masking up and working out. But now that that's down, I feel like I can go back in there and I feel safe because I feel protected. And that's kind of what the CDC is telling us, right?
Exactly. It's a great point. I was at one of the popular malls here in Charlotte recently, and it was very interesting to see, half the people had them on, half the people did not have the mask on. Some people in the same party, didn't have them on, but others did. It's just very interesting to kind of see the landscape here as we move forward with the easing of restrictions.
Yeah. And I even have some friends or people that I know who have said I'm going to keep wearing it even after all of this because it's just a personal preference.
And do you think that's because they are used to wearing it at this point or because, they're trying to prevent the spread of sick? Yeah.
They just feel safer, like they're not going to get as sick.
Well, I noticed, even last night, I was driving home, and down the sidewalk, there was a gentleman walking his dog all by himself with his mask on. And I thought, okay, it's not a judgment thing. I don't care if you want to, if you feel good, like to Jess's point, if you feel safe doing it, do it. That's fine by me. But I always do pause for a second. I wonder what the story is there. There must be some reason, right?
Right.
That part, it kind of intrigues me, because, and again, keep in mind, right, the CDC is saying if you're vaccinated.
Exactly.
And we know the numbers show even nationwide, that's 50% or fewer are vaccinated.
So you don't know everybody's personal story.
Yeah, exactly. And some people can't get the vaccine, right? We know that too, right? So, it's complicated.
It is complicated. And I think as we, discussed before we started recording, part of it is, optics to an extent too. We're still kind of coming out of this, and some people might be thinking, I don't want people to think one way or the other about me depending on what I'm doing right now.
Yeah.
Very interesting. Conversation with a doctor about whether or not people will continue wearing masks post-pandemic and as we start to move out of the COVID-19 pandemic. He's the CEO or the Chief Medical Officer from StarMed Healthcare. So we got to sit down with him, talk to him about the benefits of wearing masks post-pandemic and whether or not people should continue doing it. So very interesting conversation. Jamie, Jess, thank you.
Thank you.
I recently took a walk through Romare Bearden Park in uptown Charlotte. I wanted to see if people were still using masks or face coverings. It was bright and sunny, a warm afternoon. Most people were not wearing face coverings, but I did speak to a few different people who had the masks with them, even though they weren't wearing them. I spotted Evelyn Torek walking down the block with her mask around her arm, close by in case she needed it.
If I'm outdoors, I don't have a problem with not wearing the mask unless I get really close to someone, then I get a little uncomfortable. But if I'm going into a store, indoors anyway, even when I still go into my building, I put my mask on in case somebody's in the elevator or whatever.
Evelyn told me she's in her 60s. She says she's been vaccinated against COVID-19, but she's not ready to get rid of her mask just yet. Even though you're vaccinated, do you still feel like it's better safe than sorry with the mask?
Yes. I'm just not taking any chances. I mean, someone can sneeze and you don't know. They don't know how long the vaccine is lasting, if it covers the variants, and there's more and more variants coming up, so yeah, I'll be wearing a mask for a while.
Jessica Owens was walking her dog through the park. She had the mask on, but her mouth and nose were uncovered. How do you normally wear it out and about these days?
So now I'm vaccinated. I'm fully vaccinated. Most places the mandate is kind of not a thing anymore. But if I think I might be going into like a local restaurant or somewhere where they still want to have it, I want to have it just to be respectful to like the business owner.
I know some people have completely ditched the mask because they've gotten fully vaccinated. Did you think about that, or?
Yeah, sometimes I'll go in, but then if I like go to a restaurant and I see like somebody still wearing it, then, you know, or the mask on the door thing, I just put it on. I don't care. I can wait till everyone feels super comfortable.
A man I spoke to, Wasi Akin, told me he's not vaccinated, that he's skeptical about the vaccine, so he still keeps his mask close.
I try to throw it on as much as possible. I mean, just, being amongst people, definitely making sure I have it on. As long as people are 6 feet from me, I typically, can go without it. But, kind of being in the midst of people, things like being at the grocery store and stuff like that, I tend to keep it on. So.
Do you think there's a point where you will ditch the mask?
Yeah, absolutely. I mean, yeah, for sure. Yeah, I'm not too sure when, but I mean, I don't presume to wear my mask for the rest of my life.
Each week, we bring in someone who has expertise about our given subject matter. And this week, we are talking to Dr. Aaron Piramzadian, Chief Medical Officer from StarMed Healthcare here in Charlotte. Dr. Piramzadian, thanks for being here.
I appreciate it. Thank you for having me.
Absolutely. Start off by telling us a little bit about what you do day to day as the Chief Medical Officer for StarMed.
So pretty much my role is to make sure that the medical oversight is appropriate, to make sure that patients are getting the care that they need and that we're doing everything right.
Before we get into specific questions about masks, I know you guys have been very involved with the COVID-19 vaccination efforts here in the Charlotte area. How has that been going?
StarMed is a family practice urgent care occupational medicine facility.
Right.
We have 2 offices in Charlotte. But over the past year, we've been very involved in COVID. We started off doing, I believe, one of the first main testing sites throughout the whole state. We do testing in about 18 to 20 counties each day. So we've tested about 300,000 people throughout the past year. And then we've transitioned over to doing vaccinations. So we vaccinated about 200,000 people, and hopefully more than that coming soon.
Gotcha. We're recording this here at the end of May, just for listeners. Are you guys still getting people coming in regularly for the vaccine right now, or has the number of people kind of dropped off now that more and more people have gotten the shot?
Obviously, as more and more people are getting the shots, the numbers are decreasing.
Right.
It's starting to get to the pediatric age ranges, though.
Mm-hmm.
So we're doing the 12 to 15 with Pfizer. Moderna just announced their teenage group had 100% efficacy. So starting in June, we'll be doing Moderna once they're accepted as well. We're doing a lot of interesting ways of getting out to the public to make sure that whoever wants to get vaccinated can get vaccinated.
Right.
So we're going to farms, churches, small community centers, supermarkets, whatever you can think of, we're trying to do. We're at breweries. We're giving out free beers with shots.
And just out of curiosity, do you think some people have just waited because, it hasn't been a major priority, or they were kind of just waiting to see, more results of studies involving the vaccine? Any idea about that?
We talk to a lot of patients,
Right.
especially since a lot of patients come to us to get tested. And it's interesting to hear, I ask every single patient why, if they've gotten vaccinated, if they choose to, if, what their reasoning for not wanting to get vaccinated is. The reality is there's a portion of the population that just does not believe in it.
Mm-hmm.
And, it's sad because they're putting themselves at harm, risk. They're putting others at harm, risk. And then there's a portion of the population that's, scared. They don't know if it's completely safe. They don't know what the risks are. They hear about all these terrible things, on social media. And the problem is people are getting tricked by others who are scared themselves. A lot of these myths out there have no basis, And it's just things that people are making up, and because people are scared, it just passes along.
We had a big announcement from Governor Roy Cooper here in North Carolina in May. He lifted all mandatory capacity and gathering limits, social distancing requirements, and most of the mandatory mask requirements. What did you think of that decision?
It has two different aspects to it. There's the medical aspect. From a scientific medical standpoint, it makes sense.
Right.
If you're vaccinated, you're fine. And that gives a lot of reassurance to those who are vaccinated that it works. We know that it works. We know that you're going to be safe because you've gotten the vaccine. The problem is it has the social aspect, which is where those who are not vaccinated or those who, are on that borderline are going to start taking their masks off as well. And it's going to just increase the number of people getting sick. So from a medical standpoint, I completely understand it. I completely follow it. From a social aspect, I'm concerned that it's just going to propagate bad behavior.
At the time of that announcement about easing the restrictions, the governor said there would still be a mandatory indoor mask requirement on, public transit, childcare, schools, prisons, other public health settings. Do you think that's still a good call to say, hey, in some places you're still going to have to wear the mask?
Exactly. I mean, we know those areas are more higher risk. There are people who still haven't been vaccinated. Obviously, school children under the age of 12 have not been vaccinated. So why put them at even more risk than, they're already at? Let's keep the masks. Let's keep them safe. Let's keep these numbers down and then get over this pandemic.
As a doctor, you still a little concerned about that prospect you mentioned earlier of, the unvaccinated people also ditching the masks because there's no way to tell who's got the shot and who hasn't?
Exactly. I mean, the reality is I expect an increase in the number of positive rates.
But hopefully not a major spike.
I don't think there's going to be too major a spike. I think we're definitely going to see a spike. I've already warned my staff, come in 2 weeks, we're going to get busy again. But I'm hoping it's not as bad.
Yeah, fingers crossed for that for sure. We are talking with Dr. Aaron Pirimzadian, Chief Medical Officer from StarMed Healthcare. We're going to take a quick break, and when we come back, we're going to ask him about wearing masks even after a lot of these restrictions are lifted and as the pandemic hopefully comes to a conclusion.
At Ortho Carolina, my personalized orthopedic care begins with the click of a mouse because online scheduling saves me time. Ortho Carolina, my care, my way.
Schedule your appointment today at orthocarolina.com.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Get ready. Broadway is returning to Charlotte. Blumenthal Performing Arts has an incredible selection of upcoming hits, including the returns of Hamilton and Wicked, plus the long-awaited Charlotte debut of Disney's Frozen, and many more fan-favorite musicals and plays. Season tickets are on sale now at blumenthalarts.org/BPA Broadway.
At Ortho Carolina, my personalized orthopedic care feels like home because video visits bring my provider to me. Ortho Carolina, my care, my way.
Schedule your appointment today at orthocarolina.com.
Okay, we are back now with Dr. Aaron Pirimzadian, Chief Medical Officer from StarMed Healthcare, talking to him about easing COVID-19 restrictions, specifically asking some questions about masks as well. Dr. P, do you think we're still going to see a lot of people wearing masks in public, even as we see less and less COVID-19 cases and the restrictions are lifted?
I'll be honest, I hope so. Masks, I don't know why it's become such a political issue. I don't know why people have made such a big deal about it. Masks work. Obviously, if you're not coughing on people, you're not breathing on people, you're not going to transmit illness. And we've already seen that significantly by the number of flu cases this year. average flu season, we have 39 million people who are diagnosed with influenza. And that's even with people getting vaccinated. This year, I think the number was 2,000. And I mean, it just shows that masks work. The problem is people on social media are like, oh, well, if masks are working, why is COVID still going on? And the way I try and explain this is it's like a water hose. If you start off early, there's not too many holes in that water hose, and you're patching up, let's say 50% of it, since not everyone's wearing a mask, it doesn't leak as bad. So that's how flu was. There weren't too many cases, obviously, early on. People were wearing masks. It didn't let it spread. Then you come into COVID. We're already mid-COVID. There's so many people already sick. You're patching all those holes. That's great. It's not leaking as bad, but it's still leaking all over the place. So masks absolutely work. We know they work. It wiped out the flu season, which was fantastic. Because reality is, if flu season was terrible and COVID was terrible, we would have been in the worst shape ever.
Yeah, that's a great point. I guess fair to say you think then that the masks were a big part of that. I know that, a lot of people were receiving medical treatment and, it's social distancing, but do you think the physical wearing of the masks was also helpful in preventing the spread of the flu?
Absolutely. I mean, the reality is in Asian countries, you see them all the time during flu seasons. They're always wearing masks. They're always protecting each other. They're protecting themselves. It's not something that was very common in the US. And, with it being introduced the way it was, I hope that when people are sick, I hope when flu season comes around every year, people are going to take those steps to protect each other and themselves. The big issue is obviously in the US, you need a doctor's note to miss work. People are expected to go to work even when they're sick. And what happens is it just propagates the infection. It makes more people sick because people can't afford to go to the doctor for a sick note. People can't afford to miss work. That's not how it is in other countries. In other countries, if you're sick, you stay home. You don't spread it. So at least if we have masks on, we can limit that spread as much as possible.
Any other ways masks can benefit us and wearing them, certain times of the year, other than preventing sickness? Or is that the main reason why you think people could continue to wear these in the United States?
I mean, the reality is the masks obviously work. Otherwise, they wouldn't be there. Otherwise, in a surgery, your surgeon would not be wearing a mask. It doesn't cut off your oxygen supply. Otherwise, your surgeon during an 8-hour surgery is going to pass out and fall on top of you. It doesn't cause, random infections because, your providers wear masks all the time. This is something that's very common to us, not to this extent, unfortunately. Fortunately, not to this extent. But we've been wearing masks in the medical setting for years. There's no reason to be concerned that a mask is going to cause any harm or that it's some type of, way of muzzling you or anything ridiculous like that. Now, for other benefits, I mean, reality is if, you have a facial blemish or something, it covers it up. You have bad breath, it covers it up. The funny thing is I have a med spa as well. We saw a decrease in the number of people who are getting, let's say, Botox or fillers because everyone was covering their face up. Wow. But now with that coming down, people are actually, going out there and getting all their fillers and Botox done again.
You guys really saw a decrease of Botox and fillers because people had the masks on?
Exactly. Yep.
Wow, that's definitely wild to hear. Obviously, down here in North Carolina, we have the pollen that we deal with every spring. Would masks help? Does that help with allergies?
Fantastic. Yeah. I mean, the reality is the more you cover your face, obviously, the better it's going to be. And the way the pollen is here, where it covers your car and turns it yellow and green, I mean, think about it. If you're covering your face, it's not going on inside.
Yeah, it's a great point. You already touched on this, but I just wanted to make sure. Are there any long-term negatives or things you would say, be cautious about this if you're going to keep wearing the mask, every flu season or every time you go out to the grocery store? Is there anything that could be potentially bad about doing that?
Not really. I mean, the reality is, unless you're reusing a mask for months and not washing it, not keeping it clean, bacteria does not just grow on substances like cloth or plastic. there's very few possibilities of any kind of infection happening because of a mask. There are some masks that are obviously one-time use only. There are some masks like cloth masks that you can continue using. As long as you're not, using something that's obviously soiled and dirty, there's no reason to be worried.
Any way that it can impact your lungs? I know some people, said they had trouble breathing when they're wearing the masks, stuff like that. Any way that the mask can be bad for the lungs?
No. So we've shown this countless times where we put a pulse ox on our fingers. You can run with 6 to 10 masks attached to your face and your oxygen level does not drop. The reality is it's more of there's something covering your mouth. People get anxious. Their anxiety flares up. They feel short of breath. That's really where most of that comes from.
You mentioned the mask hygiene. Is it important to make sure you're using masks, a different mask each time, or washing a mask if you're wearing the same one?
As long as it's a reusable mask, if you do wash it, if it's washable, then obviously that's important. You don't want something that's obviously soiled on your face. During the beginnings of this pandemic, physicians were wearing the same N95 for weeks to months, and nothing happened to us. We were able to at least protect ourselves from getting COVID. It took literally 4 or 5 months for us to even get enough N95s in the hospitals to be able to throw it out after even the weeks of use.
But your point is, most of those people ended up being okay. And
Exactly.
they were re-wearing the same mask. I got
Exactly. We did, besides maybe having a little dry skin on your face, it did not cause anything else.
Right. I know you're not a dentist. Have you heard anything about negative impacts on the mouth or the teeth caused by masks either?
I was reading a little bit about it may increase bacteria since it stays moist. The reality is most people are not wearing their masks 24/7.
Right.
Your mouth is always moist as is. If you brush your teeth 3 times a day, you're going to be just fine.
And I would imagine, I mentioned pollen earlier, this would help with pollution too. And I know in some parts of the country, not a big issue. But if you were worried about air quality or smog, the mask could feasibly help with that too, correct?
Oh, absolutely. I mean, you see this in China quite often.
Mm-hmm.
There's huge pollution clouds out there. People are wearing masks to keep themselves safe from it.
What would be your advice for people who plan to keep wearing the mask moving forward?
Honestly, I plan on keeping my mask on as well. As a physician who's dealt with COVID patients now for the past year, seeing the benefits of having a mask on, seeing the fact that even though I've taken care of, let's say, 200,000 plus, 300,000 plus COVID patients, I have not gotten COVID. And I believe it's the fact that my mask has been on consistently. I've got my mask here with me right now. I wear it wherever I go. So you should not feel any way socially pressured to not wear your mask.
Does anything happen to our immune system, I should say, if we are wearing the mask and we avoid the common cold or avoid the flu year after year? Does that have any impact on the immune system?
No. So you see this on Facebook where it says, oh, your immune system's going to garbage and, you're not going to be able to protect yourself. Your immune system protects you from each thing that you're exposed to. So if you're not exposed to it, you're not going to get sick from it. So as long as you have a mask on, you're not getting exposed to something, it's perfectly fine. The rest of your immune system continues to do everything it's supposed to do whenever it's exposed to anything else. So just because you're not going to get influenza or you're not going to get a cold because you've got a mask on doesn't mean your body's not going to be able to fight. That's like saying, because we're not getting smallpox, that my body can't fight when it sees the cold virus. We got rid of smallpox completely. We completely vaccinated. We wiped out smallpox. Your body's still fighting everything else.
And last one before I let you go, what would be your message for people who are ready to ditch the mask and say, you know what, I'm not putting this on any more than I have to? What would be your message for those folks?
For people who are completely anti-mask or, are trying to get rid of the mask, I understand. I do 24-hour shifts in the emergency department. I keep my mask on 24 hours straight. Trust me, it's not that hard to keep your mask on when you're in the public area, when you're around other people. You're doing a service to humankind. I mean, you're taking care of people who can get sicker than you, and it's not always just about you. That's the main thing.
Dr. Aaron Piramzadian, anything else you'd like to add before we let you go?
No, I mean, hopefully people are all wanting to get vaccinated so we can get over this and get back to normal.
Doctor, thank you for taking the time to talk with us.
I appreciate it. Thank you.
Thanks all of you for listening to WBTV's Good Question, a podcast from On Your Side Tonight. If you have a good question, email goodquestion@WBTV.com or use the hashtag OYSTonight on Twitter. Watch On Your Side Tonight with Jamie Bowl live on weeknights at 7:30 on WBTV. And if you can't make 7:30, you can watch WBTV anytime on Roku, Amazon Fire, or Apple TV. WBTV's Good Question is a product of WBTV in cooperation with Queen City Podcast Network and Balto Creative Media. From WBTV, Good Question is produced by Jess Dyer. Special thanks to Jamie Bowl. For the Queen City Podcast Network, WBTV's Good Question is produced by Brian Baltashevitz. Production coordinator is Taylor Robinson. And post-production supervisor, Jeremy Davis. It is recorded at the Queen City Podcast Network studios at Advent Co-working in Charlotte, North Carolina.